Zimbabwe's government says it's received $25 million from the Global Fund to use towards COVID-19 preparedness. The country is now gearing itself to fight the coronavirus. According to the Health Ministry, Zimbabwe has no confirmed case of the virus as yet.
We want to now start behaving as if we have the coronavirus in Zimbabwe, even though we still don't have it. We have to behave in a manner that will make sure that we don't spread the virus when it comes, if it comes. We are taking into consideration that there are increasing cases in the region, and in particular in South Africa, just across the border from Beitbridge. And we know that there's a huge flow of travelers to and from South Africa. We are therefore making recommendations that as we go into the Easter festivities, knowing all about these huge gatherings that would come, we will be making recommendations that we reduce the numbers at these gatherings. So we want to make sure that we don't have huge gatherings.
The World Health Organization says the absence of confirmed cases does not mean there's no coronavirus in a country. They are advising all countries to adopt a wide range of preventative measures and assume that it's only a matter of time before the pandemic hits. Advice some political leaders have taken heed of.
I saw President Kagame joining the hand wash challenge, which I'm sure I'm going to also join very soon, and ask perhaps President Malema, Bobby Wine, and my brother Edie to also join. But that is what we must do. We should not be partisan about it, because diseases are not partisan, they're non-partisan. We cannot afford to talk politics about it, because health is beyond politics. It is about life. And we can't afford to be political about it. We can't go into politics or wish others bad, or thinking that we will not get this kind of a challenge.
Cases of the coronavirus continue to increase in Africa. At least half of her countries have recorded cases of the COVID-19. Egypt is the worst hit with 150 cases, followed by South Africa with at least 62 confirmed infections. While Zimbabwe may seem safer now, there is a growing concern if the country's embattled health system can cope if the outbreak reaches its borders. Currently, the country has a combined capacity of just 55 isolation beds.
We know that neighboring South Africa has had now maybe it's about 62 or so. 62 years we can work with at this facility. But their strategies should the outbreak go out of control like it. We can put up tents here, we can also mobilize Beatrice Road Infectious Disease Hospital. It depends on the care that we're going to give. It's only going to be supportive therapy that we can give. But as you can see, people are working on intensive care right now. They are working behind there, setting up intensive care facility, and also making sure that the machines are there. But we will not be able to admit 62 patients needing intensive care support. We will only admit those that we can. But for now, we should be able to handle the few that are coming in.
The Health Ministry has placed a Bulawayo woman together with her family in isolation after the doctor she consulted in South Africa for a separate medical condition tested positive for the virus. She will continue to be monitored. The government also reported a British tourist who left Zimbabwe on the 10th of March via South Africa had tested positive upon his return to the United Kingdom. More than 180,000 people have been affected with the virus, with over 70,000 dying due to the viral infection. Noma Polani, SABC News.